Dealing with Medi-Cal reimbursements for abortion services.
Yes. So I'm here to present AB 576, which updates the Medi-Cal guidelines for abortion medication. Medication abortion is a safe and effective method of terminating a pregnancy and is preferred by many people who obtain abortions. Since the U.S. Food and Drug Administration first approved the drug for medication abortion in 2000, its use has grown substantially, and in 2021, half of abortions in the United States were medication abortion. Currently, Medi-Cal only covers medication abortion for up to 70 days gestation. Yet a 2019 study demonstrated that medication abortion for pregnancies between 71 and 77 days was safe and effective, as the regimen is for 64 to 70 days. There are over 8 million women eligible for Medi-Cal in this state who have more limitations on their access to the abortion pill than those in the private insurance market. For those reasons, AB 576 would require the Department of Health Care Services by March 1, 2024, to review and update Medi-Cal coverage policies for medication abortion to align with current evidence-based clinical guidelines. After initial review, the bill would require the department to update its Medi-Cal coverage policies for medication abortion as needed to align with clinical guidelines. This bill would also require the department to allow for flexibility of providers to exercise their clinical judgment when services are performed. By extending the time that a pregnant individual can receive abortion medication under Medi-Cal, we are allowing families to make the family decision planning that is most appropriate for their life. This bill is sponsored by Essential Access Health, the National Health Law Program, NARAL Pro-Choice California, and Planned Parenthood Affiliates of California. Here to testify with me today is Molly Robson with Planned Parenthood Affiliates of California, and Dr. Upadhyay, hopefully I said that right, Professor of Obstetrics and Gynecology and Reproductive Sciences at UC San Francisco.
Thank you very much. You could say your own name there. Go ahead.
Yes, thank you. Good afternoon, Chair Eggman and members. I am Dr. Ushma Upadhyay, Professor and Public Health Scientist at University of California, San Francisco. I'm here today in support of Assembly Bill 576, which requires DHCS to update their billing policy for medication abortion to reflect evidence-based research, clinical guidelines, and the discretion of the clinical provider. Medication abortion has taken on a pivotal role in abortion care in the wake of the Dobbs Supreme Court decision. It now makes up well over half of all abortions nationally. For a long time, Medi-Cal policy required 2 ultrasounds for reimbursement. I analyzed Medi-Cal data on over 11,000 medication abortion patients and found that they were routinely required to make return visits for post-abortion ultrasound when most providers across the rest of the country had long stopped requiring this unnecessary in-person follow-up visit. Patients too often receive the care that will be reimbursed rather than the care that they actually need based on the best medical evidence. Additionally, studies show that medication abortion is extremely safe and effective through the first trimester up to 12 weeks of pregnancy, and this is endorsed by the World Health Organization guidelines. Yet Medi-Cal reimburses only up to 10 weeks of pregnancy. A new UCSF study found that over 1/3 of abortion providers across the country currently offer medication abortion care beyond 10 weeks. With an additional dose of misoprostol, a medication abortion between 9 and 12 weeks is just as effective as earlier in pregnancy. Science is continually evolving, and I want Medi-Cal members to avail of the latest evidence-based care. I am proud to be here in support of AB 576 and respectfully urge your support on this bill today. Thank you.
Thank you very much, Doctor. Next person, Ms. Robeson.
Good afternoon, Molly Robeson with Planned Parenthood Affiliates of California. We represent the 7 affiliates in the state who offer sexual and reproductive health care through over 110 health centers in California. Medication abortion is a preferred method for ending a pregnancy. It has been for the last 2 decades, and at Planned Parenthood Health Centers, more than 70% of patients seeking an abortion end up receiving a medication abortion. By extending the window in which medication abortion would be available just to be in line with clinical guidelines, an additional 10% of Planned Parenthood patients patients would be able to choose medication versus being kind of forced into a in-clinic procedural abortion. So this bill really will address unnecessary barriers to care and address kind of equity gaps in coverage between Medi-Cal and private insurance. So as such, would respectfully request your support on this bill today. Thank you.
Thank you very much. Okay, now's the time just for people speaking in general support to come forward. Name and affiliation, and we assume you're speaking in support.
Taylor Jackson with California Health Plus Advocates, here in strong support.
Tiffany Matthews on behalf of Attorney General Rob Bonta in support.
Taisha Watts with the California Academy of Family Physicians in support.
Brandon Marchi with the California Medical Association in support.
Hello, Genesis Gonzalez on behalf of Lieutenant Governor Lenny Kounalakis in support. Thank you.
Brian Spencer, American College of OBGYNs, District 9 in support.
Kathy Mossberg, proud co-sponsor, Essential Access Health in support.
Karen Lang on behalf of the City and County of San Francisco in support.
Karen Stott on behalf of NARO Pro-Choice California, proud sponsor of the bill, as well as the California Nurse Midwives Association in strong support.
Thank you.
Dia Scrub, family medicine physician, representing myself in support.
Thank you.
Mari Lopez, California Nurses Association in support.
Thank you very much. Okay, now those speaking in opposition to the bill may come forward at this point.
Committee members, I'm Sophia Lorey and I'm with California Family Council. AB 576 would require taxpayers' Medi-Cal funding to fully reimburse providers for medication abortions up to 77 days gestation, whereas it currently covers 70 days. The FDA has granted approval for the use of abortion medication up to 70 days of gestation. It is important to note regarding AB 576 that the FDA does not approve the administration or consumption of abortion medication after 70 days of gestation. Let's walk through what abortion medication does. A medical abortion is done by taking two pills, mifepristone and misoprostol. Mifepristone chemically starves a preborn child of progesterone, which causes the placenta to degenerate so that it can no longer provide oxygen and nutrients to the child. The woman then takes misoprostol within 24 to 48 hours, causing severe cramping, contractions, and often heavy bleeding to expel the dead baby out of a woman's uterus, usually on her own, sitting over a toilet. Through this bill, Medi-Cal will be forced to pay for abortion medication up to 11 weeks of a pregnancy. So let's walk through what the first 11 weeks of a pregnancy looks like. By 3 weeks and 1 day, a baby's heartbeat can be detected. Between 5 to 6 weeks, the baby's lung and digestive systems start forming and brain activity can be recorded. At 9 weeks, the baby can suck their thumb, sigh, and stretch. At 10 weeks, a baby is about 1.25 inches long. All vital organs are in place, and their teeth are starting to harden and connect to their jawbone. Every successful medication abortion ends in at least one person dead. Since 2000, 5.6 million unborn children have died from abortion medication. Since 2000, 28 women have died from abortion medication. This is not misinformation. This comes directly from the U.S. Food and Drug Administration. The FDA has also reported that since 2000, 1,048 women have been hospitalized, 604 women have experienced blood loss requiring transfusions, and 414 women have experienced infections, all due to abortion medication. And while I do not have time to dive into this, I do want to note that currently there is a case before federal court which could lead to the court ordering the FDA to withdraw these dangerous chemical abortion drugs from the market. Due to the current case and the physical harm that abortion medication causes to women, taxpayers' Medi-Cal funding to fully reimburse providers for medication abortions should not exist at all, let alone be increased to 77 days gestation. I urge a no vote on AB 576. Thank you.
Thank you. Anybody else speaking in opposition to this bill today? Anybody just want to say no to this bill today? Okay, seeing none. Bring it back to the committee, I think. All right, I think we have no comments. Dr. Weber, would you? Oh, telephone, thank you. Let's go to the telephone lines. Do we have any callers?
Thank you. Yes. For support or opposition of AB 576, please press 1 then 0 at this time. Go to line 363.
Go ahead, please.
363, you're open. No response.
Okay.
Line 392.
Yes, my name is Wendy Palatucci. I'm a mother and an aunt to be, and I strongly oppose this bill.
Thank you.
Line 398.
Hi, my name is Raquel. I'm with the National Association of Social Workers California chapter, and I strongly support this bill.
Thank you. You guys a caller?
Line 285.
This is Gabrielle Ingram, founder of Stand Up Sacramento County. Strongly oppose this bill.
Thank you.
Line 303.
Linda Rich, Placer County. I strongly oppose AB 659. First extension.
Okay, we're not there anymore. Thank you. Next caller, please.
Line 378.
Heather Keller from Sacramento County, oppose this bill.
Thank you. Next caller.
Line 396.
This is Angela Shannon, representing LA County, and I oppose this bill.
Thank you. Next caller, please.
Line 203.
So this is John in San Bernardino County, and I oppose the bill.
Excuse me, sir. Which bill are you opposing?
576.
Okay, thank you. Next caller, please.
Okay.
One moment, please. We go to line 363.
My name is Andrea Hedstrom, and my affiliation is a mother of 4 who has had 2 mifepristone misoprostol abortions, and I am pro-choice, and I oppose this bill.
Thank you very much. Next caller, please.
Line 303. One moment, please. Line 400.
Yes, hi, my name is Margaret Boyles, and I am from Los Angeles County, and I oppose this bill as the abortion is life-threatening.
Thank you very much. Next caller, please.
Okay, line 303.
Hi, Linda Rich, Placer County. I'm sorry, I had the wrong number. I oppose AB 576. Thank you.
Thank you. Next caller, please.
Okay, Madam Chair, no further comments in queue at this time.
Thank you very much. Now would be the time to bring it back to the committee. Seeing nobody wishing to comment, Dr. Weber, would you like to close?
Every single day matters when making such a major decision, and the decision should not be dependent on whether an individual has the funds to cover this medication. I respectfully ask for your aye vote. Thank you.
Okay, thank you very much. This does enjoy a due pass recommendation, and we'll, when we get a quorum.
I want to be established. There's 6 of us.
Thank you.
Thank you.
Thank you.
Sorry, Madam